Good afternoon to all of you. And a relative buzz in something which we call as immersive learning. And as far as the role of immersive learning in medical education is concerned, how beneficial it is, what are the drawbacks, does it, to say, interfere with the traditional methodology? Is it the future, or it is just an augmentation to the already existing system we have? So, what is immersive learning? We have to remember that as far as immersive learning is concerned, it is more than a single specific practice, and it covers a wide range of approaches in medical practice, in medical learning, and medical teaching. And what we use the virtual reality, we use the augmented reality, and we use the mixed reality. And we have to see whether these promises, what all these technologies have, are they really beneficial to the medical teaching as far as the onset is concerned. Now we just start the use of this technology, especially in applied anatomy. And once we say about applied anatomy, we just mean ENT, we just mean general surgery, we mean radiology, we mean orthopedics, and wherever possible in gynae ops. So, what is it? A mixture of virtual reality, augmented reality, and interactive interaction within both these technologies. So, what basically the virtual reality is that it creates interactive 3D clinical environment. So, is the 3D clinical, say, environment really at an early stage of the career useful to the students? Now, as the professors, as the associates, assistants, or merely the teachers in basic sciences are concerned, we see that the standards of medical education are fast declining. And do we really need to bring this practice into being? Because we see that the students are losing a lot of interest in their books. The books are becoming more interactive to the students. But despite the fact that the traditional methodology of dissection, the teaching, and many of the institutions which are using some more techniques for involving the students, are they really helping? To my knowledge, as yet, there has not been a profound effect of using newer technologies wherein we get the students involved in a more interesting manner, and that has a profound effect on their performance. As yet, this is early stage. The data is not there substantially to prove these things, but I never am of the opinion that these techniques should not be implemented. But only thing is that a critical balance between the use of these technologies and the traditional methodology of teaching has to be borne in mind by any educational institution or any person who is involved in delivering medical education at the beginning of the career, and that is very critical. The base is there, and if we dismantle the base, it can be having repercussions after, say, in the following years. So, what we have is a fundamentally a system which is there to just augment as such. Now, then, augmented reality. I have seen it myself. It is a time consuming thing which has not been liked by many of the staff members, as far as the concerns of so many things are there. The use of, say, the networking issues, the time consumption issues, and the real benefit which has not been seen or proven as yet. So, as far as making the concepts clear is concerned, we can use these for improving the techniques of methodology of teaching, especially in osteology, where in myology, vascular anatomy, vascular surgery, and embryology, wherein a reconstruction of 3D environment would be very, very beneficial and make it more interesting to the students. So that is one part of using the technologies in our hand. Now, evaluating spatial anatomy, 3D exploration versus traditional focus. The technological claim, what the people, what the companies concerned with the making of these tools are there. They make a lot of, I mean to say, positive claims about the use of this technology. How does it benefit to the educators? Is there a difference between the educators and the viewpoint from the people who are making these products? And they claim that it replaces traditional textbook diagrams and cadaveric labs. Now, it allows students to explore human anatomy layer by layer with 3D special models that can be dissected and visualized from inside out. Absolutely. I have myself used some of these techniques, and does it really benefit from a student's viewpoint, from a professor's viewpoint, from a teacher's viewpoint, from a senior faculty viewpoint? It is to be seen from a different angle, and from a student's viewpoint, it is to be seen from a different angle. Now, many of the medical colleges in our country, they do not have the basic facilities available as well, and they cannot think about getting these technologies into their colleges because the standard of the colleges always differs. Each place, each college is different from any other college, and I tell you with full guarantee that many of the colleges cannot implement these systems there because of financial burden, because of so many problems in procurement, in, I mean, say, getting these things as soon as possible, even if they are needed on urgent basis. So the thing is that there are certain issues which are existential in nature, which are real time in nature, and we can do nothing about those issues. Procuring these technologies is not an easy job once there are financial burdens there with the administrators, private or government sector. That is one important thing. Then the claims of these companies that they really replace traditional textbooks. We can just replace the diagrams in the textbooks with the 3D models. The issue is that once it comes to examination, a student can never draw a 3D diagram which he has seen. So this remains as a concept which is not practically implementable, I would say, as far as the examinations are concerned. And I tell you, books retain immense fundamental value. Here I am talking about standard textbooks, about the books which have got graphic representations, which have got beautiful, I mean to say, the atlases, like the Grant's Atlas, like the Natus Atlas, and all the high yield books which are there, which have got a long tradition, which are used by certain anatomists at this point of time as well. And on getting the feedback from the students, the books retain immense fundamental value. High-tech solutions like these, they can just cause one important thing, and that is distraction. Once a student is on the social media, once a student is using these technologies, he or she is bound to get distracted unnecessarily. And this traditional methodology has been time proven, and we find that students who retain their value in reading books, in using older methodology, do far better than having these things in mind. Now, what is the haptic illusion? Especially here, I am not talking about anatomy only. I am talking about surgery. The claim that you can just do these simulations in, I mean, say, risk-free environment, and then how much of a beneficial these procedural things. You just train a student of surgery, show him some surgical procedures, and then he does it in an artificial environment. And once we just ask the same student to do it in the real-time environment, is there the difference? Does it really make a difference? At this point of time, we have not evolved to such a significant data that we can predict that, yeah, it has made a real difference, that this technology used in artificial conditions does really benefit in real time practice, because trainees do not do well despite much artificial training. This training in artificial environment does not necessarily mean that the same person who has spent a lot of time in artificial environment will do good in the real time environment. The real time environment is different. The real world experience is different from the artificial, I mean, say, procedural technology or the artificial mastery which we do during our training. So yeah, I never say that this should not be done, but but substantiating the fact or equalizing the fact that real-time environment and the artificial environment are same. No, it is never the same. So we have a lot of difference, and yet the data has to be there to prove, yeah, it can be just significant. Now, AI algorithms versus artificial or authentic human empathy. What is important? We once there is a lot of difference between real-time environment and artificial environment. We have high stress emergencies, a lot of trauma coming in sometimes, a massive RTA, where many people are simultaneously injured, a blast injury, where many people are simultaneously injured with blast injuries, with pellets here and there, with bullet injuries here and there, and it is entirely different. We have seen trauma, we have seen a lot of trauma in our life, and we have faced these difficulties, and we know that there's a more panicky situation once there is, I mean to say, an actual emergency, and making it simulate in an artificial environment is entirely a different ball and game together. Now, AI driven conversational algorithms, they are fine. We just have a protocol. We can just do a lot of background work, and we can have a lot many hypotheses, but putting these hypotheses into practical work is what matters. Do these algorithms always work? I tell you, more than half the times they do not work, because the real time environment is entirely different from the artificial environment. And the AI algorithms and the data which we have, it relies heavily on company based audits. The companies which make these technologies, which make these products, which make these basic skill facilities, have got their own data and internal articles and derivatives. I mean to say that the derivation of some of the conclusion which they have should not be relied wholly and solely. So what happens, because as yet we do not have significant data from the hospitals, from the medical colleges, so that we cannot make a substantial, I mean, say, conclusion from all the things. So as yet, I do not completely agree with the company-based audits, the company-based data, and whatsoever proportions they put in front of us. So that is to be taken care of by all the people. Now, is there any advantage in these technologies? Yeah, we would not deny some of the facts that yes, there are a lot many advantages of these immersive techniques which we will be using ahead in our medical education, teaching, and surgical training as well. Superior knowledge retention. It does not, I would say, with a lot of evidence, we cannot conclude that there is a superior and a significant knowledge retention. But yes, it augments knowledge retention because you are making the knowledge more presentable, more, I mean to say, interesting, and more mind absorbing. And many of the students find that we have and we want to use this technology to get more involved in our subjects, in our studies. So that is a very positive impact, better long-term knowledge retention in some cases, not in all cases. And for that too also, we have to have a very good, I mean say, educator who just educates us in a proper manner. So traditional learning along with superior knowledge retention from the immersive methodologies of teaching learning can be substantially helpful. Now, risk-free environment. Assume that you are putting up a surgical trainee, a ER resident, or a trauma orthopedic resident into a real-time situation in the first instance. He or she would get confused. He or she will not know what to do. He or she will not be having the protocol. What this training does, immersive training helps a lot there, because you have already, I mean to say, sensitized the person. If these things are coming up there, what should be your protocol? There should be now time wastage, the precious minutes, the precious seconds which are there, and how to arrange yourself as a team, how to coordinate. This type of training is very very important, whether it is your basic life support, whether it's advanced trauma life support, or it is dealing with multiple emergencies at a single point of time. So that is very important, because this type of immersive learning helps you in training in a risk risk-free environment. So there is no risk to the patient, there is no risk to you, and you learn a lot should you be interested and involved in a very nice manner. So that again is dependent upon your interest, your inclination, and your observance and your dedication towards learning. So that's another part. Standardized assessment. Now, what this data is important, and what this does, this provides educators with objective data-driven metrics to track, so you can compare. Because even if you do not rely on the companies who are making these products, you do some of the surveys yourself, find an impact factor, how helpful it is, so you can just do a real-time true data analysis and your objective data driven metrics to track performance, physical responses, decision making in real time, and other modalities whichsoever you want to derive, where you can do it of your own. So we cannot rely, there is no need to rely on the companies or only. You can just do some amount of exercise, some research, some publications on this aspect as well, and derive true data, what would be significant, and share it, and that can also help. Now, these independent company audits who do the testing, most likely they lack uniformity. I have talked to many people around, from immersive technologies, from the company people who make it, from their senior people, from their junior people, and I have found that they lack uniformity of assessment of explaining. And medical education itself currently lacks uniformly tested independent standards for immersive technologies. So that is one drawback, that we cannot arrive at a specific conclusion as yet. Biased data sources. Much of the supporting literature is derived from company based audits. So once they have, it is just like any company making a product, giving all the positive feedback in the market about that, just I would say minimizing the exposure to the negativities, and that is not a real thing which we should be much inclined and interested in if the data is not healthy. That means we have to have both the positive aspects, the negative aspects, for us to make a conclusion whether we want to use it in our educational institutions. The illusion of mastery. Now, artificial environment, you can say that I have mastered this thing, and that is something which gives you an illusion. So you are always used to this fact that, yeah, I am the superior most boss, and I have learned a lot. And once I put you into the practice, there you turn out to be nothing but just a time wasting individual who has not learned anything as yet. But that should not be, I mean to say, the responsibility lies on yourself, not the companies. The important is that the illusion of mastery sometimes arises as a result of immersive education. So what you, and that distracts you from traditional methodology of teaching and learning. So that's very important to be kept in mind. So as far as anatomical, surgical training is concerned, and the soft skills and empathy is there, there's a lot of this chart determines that, again, the same things what I told you repeated. I mean to say, AI driven algorithm simulation, what the real term human variables are there, the risk of distraction, the poor original performance, and reliance upon unproven company audit data. So this is a chart which compares the three things. So you have not to, I mean to say, get immersed in immersive education as much as the reality would not suggest it. So that's a very important point to be kept in mind. So navigating the future of medical education curriculum. So number one, number two, and number three, leverage for assessment. Yeah, we can adapt VR, virtual reality, augmented reality, and mixed reality specifically for its objective data training, standardized assessment, and risk-free task repetition. So we cannot totally negate, though, no, the immersive learning methodologies are all false proven. The companies are all saying the wrong things. No, it has got a role, it has got a positive advantages, and it has got those long-term retention capabilities which I told you. It is more mind absorbing, it is I mean to say, it is more interesting, and it can augment your methodology as well, teaching methodology, I mean. Preserving the core, I would just suggest to the educators that they retain the traditional methodologies, the books, the dissection, the Cunningham's manuals as far as anatomy is concerned, the atlases, the histology atlases, they are irreplaceable. And then you can use, I mean to say, these techniques to boost up your knowledge, to boost up your confidence, to boost up your performance, but not as total alternative methods for replacing your conventional dissection methods, for replacing your books. It is not meant for that. If you think that the illusion, again, the sense of illusion, then I think that you will face a lot of problems in your career. And what we demand is a rigorous proof add, because as such, again, the data is not there. I would say a lot of research is not there. We had to go, and in 5 to 10 years time, we will be seeing coming a lot of data coming out from different educators, from different houses, from different educational institutions, who can afford those things and have to rely on those, because the poorer, I would say, colleges, the colleges with poor infrastructure, the colleges with lesser amount of budget, they cannot do these things at this point of time. So again, they have to rely on their higher educations institutions for the data, and then we have to make substantial, I mean to say, conclusion from the data, and see whether we would use it in real time. So what the conclusion is? The conclusion is that immersion technologies, immersive education, it is an augmentation. It is not a replacement. It is not a valve replacement. It is not a total knee replacement. So in a similar manner, it is just an augmentation. And this augmentation is an extremely useful tool that I would admit that immersive learning is a, I mean, say, important tool for risk-free preparation and standardized real-time assessment. That is the role where I find immersive learning is of importance at this point of time. Maybe I might have to change my views at a future point of time, but as such, I find that it is just an augmentation, not a replacement. And fundamentally, it cannot replace the tactile, the chaotic, and time-prone realities of traditional methodology which we have been using. So that is important as far as the immersive learning is concerned. Don't rely much on it at this point of time. Be a master of your subject, master the art and the craft which is there. You are anatomist, you are surgery allied people, and important is that this will not replace your skills. So thanks for watching, thanks for your attention, and I wish you best of luck. Thanks a lot.